Honestly, this is what turned me off from being a liver transplant ICU nurse. And this is no shade to any of the nurses I work with. That unit was wonderful. They were like a family to me. 10 out of 10. The nurses, 10 out of 10. But I just felt like we were being so dishonest. We were being like, it was like we were lying. Like, you have a patient, high MELD score. I'll talk about MELDs later, but you know, they have a 100% mortality rate in 3 months if their MELD score is 40 or higher. And the surgeon will say, you know, the only way to save your life is if you get a liver transplant. Like, that's it. You can't heal from liver failure. You just can't. And they will also tell you that we have a 98% success rate. And I mean, technically it's true. Technically, there is a 98% success rate, but that only counts for the first year. That only counts if you make it alive for the first year. And then let's say you die on day 367. Doesn't matter. You made it through the year. You're a success. And they also don't tell you for the majority of that year, you will have a gruesome recovery period. Liver transplant is one of, I think, like 3 or 4 open abdominal surgeries left in medicine. And it takes months to recover. Months of being in horrible pain, months of drains, months of possible infections because you're now on anti-rejection meds. Like, people don't just get a liver transplant and then walk out the next day fine. Sometimes people don't walk out within the year fine. I took care of patients on that unit that have been with us for over a year. A year and a half, I want to say, is like the longest. But it's like, did we tell y'all that? Did we tell you guys that it was going to be like that? Did we make it very clear that this will be the hardest thing you will ever do in your life? I don't think so. I don't think so. And I promise, I swear to God, we would get like educational emails, you know, every week from our educator. And when I saw that 98% success rate slide with the little asterisk that said for 365 days, I was done. I'm like, get me out of here. This is wrong. Also, because of the things I've seen in liver failure patients and like liver transplants, I truly don't think I'd ever get one. So don't overdrink. Please drink in moderation, because that is not fun. It's actually deadly.